Good afternoon. I'm Kelly Malcolm, the Research Communications Strategist at the University of Michigan Medical School, and your moderator for today. I am delighted to have you join us. Today, we're here to discuss how air quality can affect your health. Air quality changes from day to day, but events like wildfires and environmental disasters can make it much worse. Air pollution can increase the risk of heart disease, stroke, respiratory infections, and other conditions. It's something that those with lung diseases like asthma should be especially mindful of, since poor air quality is more likely to negatively impact people with health conditions. Our panel of University of Michigan health experts is here to talk about the issue and to tell you what you can do to minimize the effects of air pollution on your health. Thank you to everyone who sent in questions in advance for our experts to address. We'll also take some live questions after the panelists' presentations. If you're watching this live on Zoom, you can submit your questions at any time using the Q&A button at the bottom of your screen. Our panelists are all leaders in their fields and dedicated to making a difference, and it is my pleasure to introduce them. Joining us today are Dr. Meilan Han, Chief of the Division of Pulmonary and Critical Care Medicine, and the Henry Sewell Endowed Professor of Internal Medicine. Alex Rabin, Clinical Assistant Professor of Pulmonary and Critical Care Medicine, and Meredith Petty, Assistant Research Scientist of Epidemiology. At this time, I'd like to give each of our panelists the opportunity to talk about their specific area of expertise. Following their presentations, we will begin the Q&A session. First, I'd like to welcome Dr. Meilan Han to discuss how you can protect your lung health from birth to adulthood.
Thank you, Kelly. It's a real pleasure to be with all of you today. So my name is Meilan Han, and I am Chief for Pulmonary and Critical Care here at the University of Michigan. And I think in the last few years, we've all become aware of all of the threats to our lung health. First, it was COVID, and now it's been wildfires. And so we, as a pulmonary community here at the University of Michigan, really want to try to educate the public on how we think about lung health more globally and the things that you can do at home to try to protect your lung health. So my talk today is really focusing on sort of all the things that as a physician I think about when I try to educate someone on how they can protect themselves really from birth all the way through adulthood. These are my relevant disclosures. So I will admit to you that much of my thinking on this topic really started with the pandemic. So we now have over 1 million Americans that have unfortunately died from COVID-19. When we think about what people died from, the majority really it was respiratory failure. But I think one of the really kind of confusing things for many of us was why some patients did well and some patients really got so sick. And what I believe as a lung physician is that there probably were many people who had some lung injury or lung inflammation prior to getting infected with COVID, and that this likely contributed to sort of the heterogeneity that we saw with respect to some people who were seemingly healthy who got quite sick, and others who surprisingly did quite well. And it really has gotten me thinking about all of the things in the environment and that we are exposed to, sort of just as part of daily life, that impact our lung health. And you may not realize this, but even before the pandemic, lung disease was a major killer globally. And so sort of my thoughts on this, I sort of kind of encapsulated in this op-ed that I published in the LA Times, which was really kind of at the height of, I think this was sort of the Delta surge here in Michigan. But if you look at how we're doing with other leading causes of death, cancer, heart disease, stroke, et cetera, we've really made a lot of progress in the last 50 years. Unfortunately, when we look at chronic lung disease, and here I'm highlighting COPD, or chronic obstructive pulmonary disease, which is actually third leading cause of death in the world, we're actually losing ground. And I don't think that this is necessarily because we as a healthcare community are necessarily getting worse. I think or that our treatments are getting worse, but rather we have a lot fewer people dying from some of the other things. We're doing better with heart disease. We're doing better with cancer. And on top of that, we also have increasing environmental threats to lung health. And so I think the pandemic should serve as a wake-up call to all of us that we all need to be paying a lot more attention to our lung health. Now, one piece of data that I became aware of before the pandemic, and I think we as a pulmonary community really sat up and took notice, is this. So chronic obstructive pulmonary disease, which encompasses things like emphysema and chronic bronchitis, and definitely is seen in patients who have a tobacco smoking history, but by no means is exclusive to that. One of the things that was really shocking to me was this paper that was actually published in the New England Journal of Medicine a little before the pandemic. And sort of the shocking thing that it demonstrated is that as physicians, we sort of in our mind had this thinking that lung disease like COPD occurred because you had more rapid lung function decline as an adult due to things like tobacco smoke. And that's the red line, how that people would experience more rapid lung function decline in adulthood. But what was really shocking about this study is they looked at life course trajectories for lung function. And they found that of those individuals who ultimately got COPD, only about half were actually on the red line. The other half are on the black line. And if you'll notice, the black line doesn't really have accelerated lung function decline over age. What they had was failing to meet peak lung function in the first place. And that's roughly half of the individuals who ultimately develop COPD, which is quite shocking, right? Because I'm going to guess that many of you, probably all of you listening to this, have had your blood pressure checked. But how many have had your lung function checked? We don't routinely check lung function, and therefore many people may not know that something happened either in the womb or in childhood or as a teenager to make it such that they never hit peak predicted lung function. I have a 10-year-old, and we track kid's growth every time he goes into the pediatrician. I've got his height and his weight, and I know exactly where he is on that growth curve. And we would know if he was falling off the growth curve, but we don't ever check lung function. And so I can't tell most of you whether you've actually fallen off that growth curve. And I think that ultimately is something that I've been chatting with other pulmonologists across the world, and I think this is going to need to change. So I want to spend just a few minutes talking to you about about factors that impact lung function sort of in the womb, growing up, and then as we mature into adulthood. So one of the major issues for kind of in the womb are maternal tobacco smoke, maternal air pollution, as well as preterm birth. You may be surprised to know that no matter how old a patient is, when I first meet them in my clinic, the first thing I asked them was, tell me about your birth history. Were you premature? You would be shocked to know the number of patients I have picked up with some kind of lung disease where I believe that the origins really started with premature birth. And people many times do not remember that they actually had respiratory issues in infancy. The other major thing that we think about in childhood is infections. Pneumonia is actually the #1 killer in the world of children under 5. And repeated respiratory infections in childhood can set you up for failure to hit peak lung function in adulthood and problems later on. So I mentioned to you that we don't often check lung function, and the only way that we have this kind of longitudinal data that I'm showing you here in the graph is from studies that are funded by places like the NIH. And so what we're seeing is that there's all sorts of trajectories that are possible. Children maybe say preterm and have low lung function, but maybe some kids actually catch up. Other kids never catch up. And so this is really challenging as an adult and seeing adult patients in clinic without having that prior data. I'm often just left to guess where someone is at and what might have happened. Sometimes I liken being an adult pulmonologist to being like a detective and showing up to a crime scene, 20 years later. And I'm often just doing my best to speculate what may have happened. But there are things we can do to protect our children. We can get them immunized. There are many childhood respiratory infections where immunizations are available. There are now new immunizations and treatments available for RSV, which is a major cause of respiratory morbidity in young children, particularly under 2. And breastfeeding, when possible, also helps to decrease the incidence and severity of lower respiratory tract infections. We're going to hear more about this in the webinar today, but air pollution definitely can impact people throughout their lifespan. Exposure in the womb can lead to low birth weight. Children can have problems with asthma, same with adults, and ultimately increased risk for infections and chronic respiratory diseases. I just want to highlight some data here that I think is some of the most interesting that came out during the pandemic. And what we actually saw was that this is really interesting. They looked at wildfires that occurred in the American West during the pandemic, and then looked at COVID infections and COVID-related deaths. And the interesting thing that they found was that in areas that had high PM 2.5, so this is particulate matter of a specific size, but places where people were saw large amounts of particulate matter due to wildfires, they saw an increase in COVID-related infections and an increase in COVID-related deaths. And I'll bet you that almost no one, except for maybe some patients, for instance, with asthma and COPD, knew that they actually had increased lung inflammation and that was going to predispose them to an increased risk for COVID infection. And again, I suspect that there are many people walking around that have been exposed to something either in the air, in the environment, in the home, or at workplace, where this is causing some small amounts of lung inflammation that people don't know about, that then increase their risk for other things happening. One of the other challenges we have is that we know that globally, air quality is simply getting worse. And this is due to a variety of factors. But I will tell you that for sort of, when we had the Canadian wildfires in Michigan last summer, for the first time in my life, I was paying attention to the air quality index on my phone every single day and trying to make decisions about whether I was going to do work outside, et cetera. So unfortunately, we know that poor air quality is associated with increased risk, both for developing respiratory diseases as well as flare-ups of existing ones. This just gives you a better map of what's going on with respect to air quality in the U.S. And unfortunately, much of this is dependent on where you live. It's difficult to necessarily control that. But there certainly are other things that we can do to protect, for instance, protect ourselves on not going out on really bad air quality days, for instance, and making sure you've got good filters in your home, which our other physicians today are going to talk about. I am a spokesperson for the American Lung Association, and you are going to hear more about this, but just some of the exposure that kids get at school, whether their school's near a freeway or just a bunch of parked cars waiting for drop-off and pickup, actually can impact respiratory health. And so there are groups like the American Lung Association that are really pushing for things like anti-idling policies. Indoor air pollution, it's something traditionally I don't think many of us have thought about, but if you'll remember with me back a year or two ago, there was all sorts of stuff in the news about gas stoves. and whether gas stoves actually increased risk for childhood asthma. The data suggests it does. The data has actually been around for a long time. It's just been getting more attention recently. But there are many things that you can do in your home to protect your air quality. First of all, make sure your home furnace and AC unit has a good air filter. We usually recommend MERV 13 or higher is the rating on that filter. Just running that, even when you've got bad air quality days outside, can help to protect air within the home. There are other things like making sure that you use low VOC paints, low VOC cleaning products, air out carpet prior to installation. Have your home checked for radon. Radon is one of the leading causes of lung cancer. How you heat your home can matter. Wood burning stoves, actually, particularly some of the older models, will put out a lot of air pollution into the home. So upgrading to newer, cleaner burning models, if possible. I will admit I have a gas stove in my home. I am thinking about replacing it, but at least running a vented hood when you are running a gas stove, if you have one, is something else. Just be mindful of things that might be impairing air quality within your home. The youth vaping crisis, unfortunately, is still with us. I am seeing quite a bit of inflammation on chest CT scans in a study we're doing at the University of Michigan, related, unfortunately, to both vaping as well as marijuana use. Now, in adulthood, there are many, many things that can impact your lung function, particularly in the workplace. We think about the dusty and dirty jobs and the jobs where OSHA, recommends protection, but I think there are actually probably many, many other kinds of jobs where chemicals may impact respiratory health. So it's just, you need to take common sense approaches within the work environment to protect yourselves. One of the interesting things, we are doing a study here at the University of Michigan. We're looking actually at both healthy 25 to 35-year-olds and then individuals 30 to 50 who have smoked. And I will tell you, I am picking up lots and lots of abnormalities on the CAT scans. It is really a myth that you can vape, smoke, use marijuana and not expect to have some damage to your lungs. Now, the last thing I'm going to say is that there actually are some offensive strategies that you can take. There is some interesting data around exercise and people who have high baseline fitness levels as a young adult and then either maintain or increase those fitness levels actually had the best lung function later in adulthood. Now, we don't know if that's due to just the fact that when you exercise, you strengthen those respiratory muscles. That's certainly a possibility. But one of the other possibilities is that there are actually some anti-inflammatory properties with exercise, and that actually offers some kind of protective effect. So even just walking, really, really good for you. So I'm going to end with this. This is a quote from a book I put together during the pandemic to try to educate people on their lung health. But it's that we really need to recognize, I think, as a community, the warning signs of lung injury much earlier. Spirometry which is the test we use in the office to measure lung health. It's not just a test of lung health; it's really a test of human health. And just like we check blood pressure, is definitely something I think we as physicians need to be doing more. And if you're out there and you're listening to this and you're having any respiratory issues, shortness of breath, cough, wheezing, etc., I recommend chat with your doctor and see if getting a breathing test is right for you. So thank you for your attention. I'm now going to pass it off to my colleague, Dr. Alex Rabin.
Thanks so much, Dr. Hahn. My name is Alex Rabin, and I'm a clinical associate professor in pulmonary and critical care medicine. And I'll be talking to you today about wildfires and lung health. Briefly, I am an employee of the U.S. Department of Veterans Affairs, and my views expressed today do not necessarily represent those of the U.S. government. Our work is also in part supported by a grant from the VA Office of Research and Development. I'd like to start off my presentation with this photo, which I took last summer during the height of the Canadian wildfire smoke event that we experienced here in Michigan. And on this day in July, I happened to be traveling to Monroe, and I decided to drive by the Monroe Generating Station, which is the largest coal-fired power plant in Michigan and one of the largest CO2 emitters in the United States. And I thought that this photo really encapsulated the two sides of the coin, both the human caused emissions, which are dangerously warming our planet, contributing to climate change, and also the natural effects that are happening as a result of that, that are threatening our lung health, that being wildfire smoke, which, as you can see in the photo, blotted out the sun on that day. As we know, over the last nearly million years, carbon dioxide levels in the atmosphere have reached levels never before seen during human existence. And in 2022, we crossed the threshold of 417 parts per million in the atmosphere. And in this year, we've now crossed the threshold of 420. So what effect does all of this carbon dioxide that's produced from burning coal and other fossil fuels, what does that do to our health, and how does that threaten our lung health in particular? Well, last year and published at the beginning of this year, working with a fantastic medical student named Jack Louie, we took a look at the literature to see what were the best studied, what were the most concerning areas of environmental exposures from climate change that were affecting our respiratory health and respiratory care and care delivery. And as you can see, among these threats, wildfires came near the top as one of the best studied and most concerning exposures. Now, you don't need a study like that to know how dangerous wildfire smoke is to our health. And as you can see, over the last 40 years, this is data that was published in the Washington Post. These are the number of acres burned every year across Canada. The threat of wildfire smoke really exploded last year. Really, the stage was set by extreme heat, unusually hot temperatures in the preceding year, as well as drought conditions across much of Canada. And the effect of that was that enormous plumes of smoke were generated, and of course it was particularly dangerous and really life-threatening for those in the immediate vicinity of those fires. But even far away, that smoke poses major threats to populations. And in particular, this is really a concern because you have smoke that's generated in sparsely populated regions like in northern Canada or Quebec, that then migrates to areas of huge population centers, like, for example, the Midwest or the Northeast. And so you have, even though the smoke is dissipated at that point, it's not as concentrated, you have a vast number of people who are then breathing that smoke. And so you can imagine that even if a relatively small percentage of folks who are exposed to that toxin, that toxic cocktail, a large number of them are going to be at risk. And really the magnitude of the smoke event illustrates a very concerning trend that we see over the last few decades, where actually our regulatory policies, including those that were enacted after the Clean Air Act of 1970 and subsequent amendments, you can see that in general, our air has gotten cleaner in many areas. And that's, again, because we've regulated tailpipe emissions and we've reduced emissions from stationary power plants like Monroe that I showed you in the first slide. But over the last few years, we've seen this very concerning trend where actually climate change effects, including from wildfire smoke, as well as other effects, have now are starting to exceed the regulatory changes that we've put into place to protect lung health. And again, that impact was illustrated very vividly last summer, where in New York City and in the Northeast, we saw direct evidence of the impact on vulnerable populations, including areas of New York City that are generally less advantaged, have more disadvantage, have less access to care, or already have worse health outcomes, where we saw a really significant spike in emergency department visits when that smoke blew in through the city. Now, what are the components of wildfire smoke that are most concerning? Well, really the one that's perhaps best studied and best known is particulate matter, which is essentially just the fine dust. It's not a specific compound. It's just the fine dust and that's suspended in the air, dust and liquid droplets that enter our lungs and can get deep into the terminal bronchioles, those tiny little airway passages inside our lungs. And as we see from measurements taken at the Camp Fire in California, levels of this fine particulate matter can exceed 10x those of national standards, which have actually recently been tightened. But it's not just particulate matter. Wildfires also burn manufactured infrastructure, in other words, houses, vehicles, synthetic materials. And so that creates this really toxic cocktail of smoke that potentially could have long-lasting effects. And when scientists looked at soil ash alongside a wildfire in California, they actually discovered last year hexavalent chromium, which is a known carcinogen. And children, of course, are thought to be at especially high risk. And for those who are parents, like I am, this is really a concern. Among the youngest children, it was shown that again, after a fire in California, that kids who were exposed to wildfire smoke as compared to particulate matter from other run-of-the-mill pollution from cars and trucks, for example, had a 10x greater increase in emergency department and urgent care visits. Again, signifying that maybe kids who spend more time outside and also breathe faster relative to their size are more sensitive to the particular effects of wildfire smoke. And we see that also not just kids and elderly folks are at risk, but also those who are socially disadvantaged. And these investigators developed a vulnerability index looking across the country to see what areas were the most at risk based on baseline health characteristics, including baseline cardiovascular disease, metabolic syndrome, childhood asthma. And they identified that the middle of the country, and including parts of Michigan, but also Appalachia in the south, even though these areas don't necessarily see the most wildfire smoke, the people that are living there are the most at risk to these adverse health effects. So how do we counsel patients? Well, there are a lot of things we should be doing that we can talk more about in the Q&A, but these are important aspects. Monitoring, better early warning systems, and particularly in places like in the Midwest that aren't so used to wildfire smoke. Getting folks to stay indoors when the air quality is really bad. Improving medication management, making sure patients have optimal control of their asthma or COPD, and then improving air filtration, which can be expensive, but there are also do-it-yourself cheaper options that are even endorsed by the CDC, like buying a furnace filter and attaching it to a $20 box fan. Ultimately, it comes down to climate mitigation, cutting carbon emissions and air pollution from transportation, energy use. Of course, these are national and international policies that need to be put in place and strengthened, accelerated. But also here at home, we're doing a lot at University of Michigan to try to reduce our carbon footprint, including at the medical center, which has just signed on to the U.S. Department of Health and Human Services climate pledge. And here in our own backyard, we're also trying to clean up our act. And one of the areas that we're looking at is in a research grant with Dr. Hallie Prescott. We're investigating the impact of switching from high greenhouse gas emitting inhalers, which, believe it or not, contain propellants that are also found in air conditioning and HVAC systems, to inhalers that don't have a propellant and don't contribute to climate change nearly as much. And so we're studying both the clinical and environmental impacts of this to try to do better for our patients, but also for the environment. And with that, I'd love to take any questions at the end on this or other topics related to wildfires. I'm excited to hear from Dr. Petty with her next talk. Thank you.
Thank you so much, Dr. Rabin, for the invitation to speak with you in the audience today. My name is Meredith Petty. I'm an assistant research scientist in the Department of Epidemiology and the School of Public Health here at University of Michigan. And I'm really honored to be here and to bring the topic of environmental health and children to the conversation. So one of the main exposures that our group thinks a lot about is air pollution. So as obligatory breathers, we are all exposed to some level of air pollution from the first breath we take to the last. And while our air quality has improved over the years, we still have nearly 27 million children in our country who experience unhealthy levels of air pollution. This is important because, like breathing in smoke from cigarettes, breathing in air pollution in outdoor air can damage children's sensitive and growing bodies, as it has been associated with low birth weight, asthma and reduced lung function, respiratory infections, and allergies. Strong ambient air quality standards, which are set by the U.S. Environmental Protection Agency, or EPA, are our best tool to improve air pollution exposures and health. These standards set the maximum allowable levels of each air pollutant that's allowed in ambient air. But with the increasing frequency of wildfire smoke, we're thinking about other options to reduce air pollution exposures, such as the effectiveness of filtration. Here in the Detroit area, our group performed a randomized double-blind intervention study where we installed small and relatively low-cost filtration systems in low-income residences, and then looked at the impacts on participants' personal exposure to PM2.5, which are particles in the air with a diameter just a fraction of the width of a human hair. Specifically, each patient or participant had a series of 3 blinded scenarios in randomized order installed in their home: a low-efficiency purifier, a high-efficiency purifier, and a sham filter. And what we found was that the filtration systems in the homes were an effective way to reduce personal exposures to air pollution, and we saw drops on the order of 50% with filtration. Children are also exposed to higher levels of pollution during their daily commutes. Here in the US, over 25 million children travel to and from school on school buses. And while school buses are the safest commuting method from a transportation accident perspective, many student riders experience high levels of pollution during these trips, which can represent a significant part of their daily exposures to pollution. And in fact, some studies have shown that 30% of a child's daily air pollution exposure comes from the short amount of time they spend in a school bus. Fortunately, technologies have been evolving over time to reduce emissions from buses, and we demonstrated in an observational study of over 400 children and 200 school buses in Washington state that the adoption of clean air technologies on school buses lowered children's air pollution exposures, reduced the inflammation in their lungs, and made them more likely to attend school each day. Specifically, we found that concentrations of PM2.5 and ultrafine particles were 10 to 50% lower on school buses with clean air technologies, and that measures of exhaled nitric oxide and lung function were improved in children riding the clean air school buses. We also found that absenteeism improved by 8% in children riding the clean air school buses, and that the results were even stronger among the students with asthma. Notably, we replicated this work nationally. So we looked at an EPA program that awards funds to school districts to replace older, more polluting school buses with newer, less polluting school buses. And importantly, from a research perspective, the EPA awarded this funding randomly using a lottery system. Now, this is the holy grail for air pollution research, since it allowed us to isolate the impact of the school buses on our outcomes without worrying that any differences could have been due to differences in the types of school districts that replace school buses or the times that school buses are replaced. So in other words, the random allotment allowed us to causally look at the impact of replacing old, dirty school buses with cleaner upgrades on the outcomes of student attendance, student standardized test scores, and outdoor air pollution by comparing these factors in districts that randomly won versus didn't win the funding. And we again found that the replacement of school buses improves student attendance, presumably due to better health, and it also resulted in better educational performance for students on standardized tests. We also saw benefits beyond school children with reductions in ambient air levels too. We found that this program was a very cost-effective investment as the EPA awarded over $27 million in funding, which resulted in over $350 million in benefits from the student attendance impacts alone. For each of the outcomes we studied, we found that the results were the strongest in districts that replaced the oldest, or in this case, the pre-1990 model year school buses. Based on those findings, we further estimate that if the government spending was directed at the oldest 15% of the fleet, we could see 1.3 million more student days of attendance each year, which would translate to more than $1.3 billion per year in economic benefits. Finally, cleaning the fleet is not the only way to improve health. Our work, again in Seattle, modeled the air quality and health impacts of cleaner vehicles and increased active transportation, such as biking and walking. And what we found is that replacing short drives with either walking or biking improved air quality and health, measured here as the number of incident childhood asthma cases, for the approximately 100,000 children under 15 years old in the Seattle area. We also found that the switch to active transport had more benefit on childhood asthma incidents than a scenario in which 35% of the gasoline fleet was replaced with electric vehicles. And so these findings suggested that switching to modes of active transit, when it's safe and possible to do so, of course, can have measurable improvements to community air quality and health. So collectively, this all brings me optimism, since we saw that modifications to our urban environment and how we move through the environment can improve children's health. So I want to thank you again for the opportunity to present, and I look forward to answering questions during the Q&A.
So thank you to all of our panelists. We really appreciate you taking the time from your demanding schedules to share your work and your ideas with us through your presentations. And I'd now like to invite our audience members to use the Q&A function on Zoom to submit their questions. Please note that our presenters cannot give personal recommendations at this time, but they can provide general advice. We will now begin our Q&A portion of the webinar, and we'll address as many of the previously submitted and live questions as time permits. So I see all of our panelists are here. Okay, ready to get started? All right, our first question I'm going to throw to Dr. Rabin. Do you have recommendations for kids with asthma who have scheduled outdoor time, say at recess or at school or daycare, on poor air quality days?
Yeah, that's a great question, Kelly, and one that I think the answer to that question is evolving. Here in Michigan, where again in the Midwest, we haven't really experienced what we did last year before. I would say that the recommendations are still not well delineated. But probably the best place to look for those detailed recommendations come from California, where there's been they have a lot more experience with wildfire smoke, particularly and schools and infrastructure have done a lot more. Regulatory agencies have done a lot more to prepare for those events. So I would point, and I can put it in the chat, I would point folks to some documents put out by the the government of state of California. But in general, I mean, it comes down to mostly common sense things. When the air quality index is above 100, They recommend moving recess and lunch indoors. If the air quality index is above 150, these folks recommend really kids not spend more than 15 minutes outdoors at a time. If the air quality index is above 200 and it's considered very unhealthy, they really shouldn't be outdoors at all. So those are some general recommendations, but I would say this is an area where we really need our public health agencies, regulators, to do a much better job of preparing schools. And I don't want to speak for other members of our panel, but as a parent last year, I was really surprised by how little really our schools or how differently they kind of addressed this issue. There didn't seem to be a uniform guidance.
Okay, thank you so much for that. I am going to have the next question go to anyone who wants to chime in. And this one is applicable to my own life. My son has allergies in the spring. Can someone with allergies to trees, grass, etc., enjoy the outdoors during high allergy seasons?
I guess I can chime in here. So when we deal with allergens, there's both indoor and outdoor allergens. In some ways, the indoor allergens are a little bit easier because you can control things like bedding and flooring and how often you clean and dust and air purifiers and things like that. The outdoor allergens are a little bit more challenging because there's not really anything you can do to contain the environment. But this is where, if you have children, it's really important that you work with your allergist, or if they have an asthmatic component to that, with their allergist and or pediatric pulmonologist. But there certainly are, medications, available, antihistamines, et cetera. Some patients are eligible for things like immunotherapy, otherwise known as allergy shots. So it really, I think, depending on the severity level, I think most patients can get to the point where it's manageable, but I know on some of the bad days, it's just bad for everyone. And there may be some days where it's better to stay indoors. It's hard for kids, right? We don't, it's not like you're going to necessarily move for your children. But I do know some of my adult patients have found that living in certain parts of the country, just based on their allergy profiles, has made things a little bit easier. So I think those are some general recommendations, but again, it's important that people just speak with their pediatrician.
Great advice. We have to do the dreaded eye drops and Zyrtec combo. Okay, so our next question, I will ask you, Dr. Hahn. There are long periods of time during the year that one needs to have the windows closed for optimal heating and air conditioning. How does indoor air quality affect our health?
So there are a ton of things that can impact indoor air quality, from things like wood burning stoves, gas stoves, radon, cleaning products. So a lot of cleaning products have volatile organic chemicals, which can also be harmful for the lungs. So I think, as I mentioned in my talk, I think the first thing to do is just sort of be mindful of what you've got going on in the house that might be contributing. So, clean up whatever you can from your heating sources to try to move towards more environmentally friendly options. If you can't, air filters in individual rooms are also an option. Upgrading filters within your HVAC system are also an option. The EPA actually has a list of more environmentally friendly cleaning products. You can go ahead and check that out if your home has never been tested for radon. Obviously, trying to keep anyone who smokes out of the home. So these are just kind of, but there's actually some other things now that I think about it. So paint. If you're going to be painting, if you think back, like I can remember 10, 15 years ago, before I think we were all kind of more aware when I painted my home, fumes were horrible. Well, it turns out if it smells horrible, it probably is bad for your lungs. You can get either low or no VOC paints. I just had my basement redone. And I actually, the new carpet actually off-gases a lot of VOCs. I actually asked to have the carpets aired out before being installed into my home. So these are just some, kind of, if you're aware, you can kind of think about it, ask about it, and try to mitigate.
Great, thank you. So this next question just came in live. How are pets affected by air quality? Anyone?
I have to admit, I'm not a vet. I'm not aware of any data, but I would assume that similar to humans, I think the basic mechanics of your dog or cat's lungs are the same. They bring in oxygen, let off carbon dioxide. The lungs actually have, while they're kind of doing this gas exchange function for us, they're actually doing a huge amount of filtering, which is good and bad. It's good because it tries to keep some of this bad stuff out, either the particles or the gases, out from the rest of our bodies to a certain extent. But things can also kind of build up over time and can even cause things like lung inflammation, increased risk for infections, et cetera. So again, I'm afraid I'm not a vet, but I would guess that the impacts are similar.
Mhm. Okay, this next question is for you, Dr. Petty. Living in a community with slow-moving traffic and peak tourist periods, I'm particularly concerned with air quality, auto emissions, ozone levels, and their association with cancers. How harmful are these conditions, these air quality conditions, and what should I be doing to protect myself?
Yeah. So a lot of these Dr. Rabin mentioned in his talk, but as many of us have said, paying attention to the AQI. So on high air pollution days, limiting your time outside, especially, if you have any underlying health issues, especially respiratory conditions. Also maybe limiting activities with high physical exertion since your breathing rate is higher. So limiting those to days and times with lower levels of air pollution. And then of course, air purifiers, like many of us have already talked about. And I think a recent review actually found that, indoor air purifier usage can reduce your air pollution concentrations inside your home by, 23 to 92%. It's obviously a wide range. It depends on many factors, like what the outside concentrations are, how many you have in your home, where they're located, what other sources you have in your home. But I do think air purification inside your home can be a effective strategy.
Yeah, and I would just add, those were great points, Dr. Petty. I would just add, I think, for those who are going out, who need to go outside and, for example, have asthma or underlying lung issues, respirator masks, similar to those we used in COVID, particularly N95 or similar masks are really effective as long as they're worn correctly. So if you don't wear them well, if you don't have a tight seal, then they're pretty much useless. But if you wear them appropriately, there's a tight fit. Those can be useful again in limited circumstances for most people in the summer. But again, for those who are particularly concerned and are around a lot of traffic and clearly have respiratory symptoms, those can be helpful.
Yeah, I see more and more people wearing them when they're mowing their lawns, for example. So, okay, so our next question, Dr. Rabin, how does early exposure to air pollution affect the development of childhood asthma?
Yeah, again, this is a little bit outside of my clinical practice because I'm an adult doctor, so I don't want to get ahead of myself here. But in general, I mean, I think it's known, and Dr. Han, I think, spoke to this most eloquently, that even before birth and in early childhood, it is known that exposure to bad air, whether it's tobacco smoke or other air pollutants, increase your risk of developing long-term obstructive lung disease or asthma. Especially in early childhood, our lungs are in a rapid period of growth, and actually our lungs don't finish growing until our late teens or early 20s. So one can imagine that, when our cells are rapidly dividing, and that beautiful tree that is our lungs kind of is forming. That's when lungs are most vulnerable. So I don't know if that fully answered the question, but I think it goes without saying that when kids are just developing, that's when developing and growing. That's really when then one should be the most careful.
Great, thank you so much. Okay, so this next question, I'll throw to you, Dr. Hahn. Is there evidence of secondary impacts of vaping, whether it be cannabis or nicotine? And is it harming children in the households as well?
Yeah, so as Alex mentioned, there's lots of data on all sorts of indoor air pollutants, whether it's gas stoves or indoor exposure to secondary tobacco smoke that can increase, for instance, rates of asthma, can increase the rates of flares. We know that childhood tobacco smoke is actually exposure is a risk factor for chronic obstructive pulmonary disease in adult life. One of the I think there's less data on marijuana exposure to children specifically, but one of the reasons why that's also tricky is that marijuana use and tobacco use often go hand in hand. And so trying to separate those exposures can be really challenging. What I will say is, sort of on a related note, one of the studies that we're doing here at the University of Michigan is of healthy 25 to 35-year-old kind of community dwelling, just sort of average people, bringing them in, getting lung function tests and CT scans. And I am seeing a lot of lung inflammation and abnormalities on those CAT scans that, if I did not know better, I would have thought was due to tobacco smoke. But I've been calling individuals, and I'm finding a lot of these changes, which, to be honest, I don't know that have been well described. When I ask the individuals what they've been, was there anything in their environment that perhaps could have precipitated this, I'm getting answers like cannabis and vaping, personal, not secondary exposure. So I do think that as a society and kind of from a public health perspective, we are vastly underestimating the amount of lung inflammation and lung injury related to vaping and to inhaled cannabis. I think that the risks have been somewhat downplayed, and at least based on what I'm personally seeing here at the University of Michigan in young people, I'm concerned.
And I would just echo that as well, Dr. Hahn, in my own practice, seeing similar findings on CAT scans. And I just wanted to offer a bit of hope, which is that when patients actually do stop vaping or stop using marijuana, we really do see improvements. I've seen marked improvements. So it's not necessarily permanent damage. So that, hopefully should help motivate some of folks to consider stopping.
Great, that is a little bit of a relief. Okay, Dr. Petty, this one is for you. Our viewers asked, we live in the Inland Empire in California, the place where all the Los Angeles smog ends up. What can we do to minimize the effects of the frequent poor air quality?
Sure. Again, I think we've mentioned these a few times, but limiting your time spent outdoors on high air quality index days, making sure you pay attention to that, especially before you engage in any strenuous physical activity where your breathing rate's going to be higher. I think we talked about wearing a mask and protecting your inside of your home with air purifiers.
Okay. And this one just came in. What is the mechanism by which PM 2.5, and I forgot what that stands for, contributes to heart disease, stroke, and dementia?
I can take a stab at that unless Meredith, you want to.
Go for it.
So the interesting thing is that so PM 2.5 stands for particulate matter of a specific size, but it actually, after you inhale it, they're actually finding it makes those tiny microparticles actually make it into the vascular system. They've actually been picked up, and so it's thought that endothelial and vascular inflammation caused directly by those particles getting directly into the vascular system is actually the mechanism by which it can increase the risk of vascular events. So I think that the fact that that's even possible was something that's we've only kind of realized in the last few years, but I think it just kind of further underscores, if you think about all the stuff you're breathing, realizing that it's not just because the lungs, like I said, they're filtering, but there's only so much they can do. And some of it actually is then kind of getting sucked up into the bloodstream where it can cause even more damage.
Right.
And and lungs, of course, are sort of on the front lines. But as was brought up by this question, neurological injury, renal disease among dialysis patients seen worse outcomes, and of course cardiovascular disease. So it affects really all our internal organs.
Okay, so here's another live question. My son always carried his inhaler when exercising, and now that he's an adult, he's experiencing sleep apnea. Does asthma in childhood lead to conditions such as sleep apnea in adulthood?
So there's actually a really complicated relationship between asthma and sleep apnea. We see them both together, and they seem to kind of go up and together. And it's thought that they contribute to the development of each other, but it's really hard to kind of entangle what's causing what. But there is some data to suggest, however, that people that have incident asthma first are then at increased risk for more sleep apnea later. There's also some evidence to suggest that people who have poor asthma control may have more sleep apnea than those that have better asthma control. So again, it's a little bit tricky to try to disentangle causality, but what I would say is that you want to make sure that both are well treated, because keeping both well treated will help with the management of the other. So it's possible for this individual, I don't know, they need to see their doctor, but it's possible their asthma isn't as well controlled as they think. And so getting lung function testing done, chatting with their doctor about whether it's really adequate to be on just a rescue inhaler, or whether this individual needs to be on what we call a maintenance inhaler with inhaled steroids on a daily basis for better asthma control. That would be sort of one question that comes to mind. But then obviously also making sure that sleep apnea has been well assessed and is adequately being treated separately. I will say, we see asthma kind of go up and down sometimes for some people, depending on stage of life, environmental factors. Same thing with sleep apnea. Sometimes that, for instance, can be related to things like weight. So both of these can come up and go. They're not necessarily, permanent. But generally speaking, making sure each piece of that is well managed is going to help the overall health picture.
Got it. Okay. So I think we're actually at our last question, and I'll start with you, Dr. Petty. I know you did your work in Seattle, but are there specific concerns depending upon where you live in the US?
Sure. It used to be more common that it was, urban areas, and if you live near an industrial facility or industrial region, were the most impacted. Although, as many of us have mentioned, right, the increasing frequency and of wildfires is kind of expanding the region of the US that's really experiencing impact or experiencing levels of high concentrations. So unfortunately now it's actually kind of impacting more of us, but to end on a high note, I will say, just like Dr. Rabin mentioned, the EPA did recently strengthen what's called the the ambient air quality standard. So once this comes into effect, and it will force pollution to decrease from cars and trucks and industry, we would hope to see improvements across the country.
Okay, any other thoughts from our panel?
Yeah, I mean, I would just emphasize that we've done a lot of really good work over the last 50 years to really improve air quality, and there's evidence. I just read in the paper recently in Paris, for example, where they decreased traffic pollution, cars in the city center, really is seeing really meaningful impacts on air quality and likely lung health. So there's a lot of things we can be doing, but certainly the climate crisis and wildfire smoke and other impacts of heat, are still major concerns that hang over us that we all need to address sort of the root causes.
Well, thanks to you all. This was a really great discussion. I would also like to thank the members of our audience for joining us today. The numerous attendees, as well as the thoughtful questions submitted, speak volumes to the importance of this subject matter and the power of research to make our lives better. I'd also like to thank our panelists again for joining us today, for sharing their valuable time and expertise with us. Today's conversation has been both eye-opening and thought-provoking. I'm going to go buy your air filter right after this. It gives us all more insight into some of the amazing and innovative research that we're doing here at Michigan Medicine. I'd like to extend our gratitude to the community of donors who support our efforts in so many ways. And thank you in advance to those who plan to support the Michigan Airways program that we linked to in the chat. Your gift to this fund will help support ways to improve the lives of patients with airway disease by accessing our strength in airways research to accelerate the development of personalized patient therapies. And we will follow up with everyone who registered for today's Well Aware with an email on Monday, including a recording of the webinar so you can watch it again, along with a list of the resources discussed today. Please feel free to share the recording and resources with your friends and family. And finally, I encourage you to visit the Well Aware website to stay informed on our quarterly webinars. Thank you again for your time, and go Blue.
Thank you.